Thank you for joining us for this Facebook Live. Today we're going to talk about palliative care. I'm Dr. Adam Tyson. I'm a family practice physician who did a fellowship and specialized in palliative care. I'm the medical director for University Palliative Care here at UT Medical Center, and I'm joined by...
Hi, I'm Dr. Veera Motashaw, and I'm predominantly in the Cancer Institute. My background is also family practice and then specialization in palliative care. And I'm predominantly seeing patients in an outpatient setting in the clinic. And all of my patients actually have cancer, have a diagnosis of cancer. And Dr. Tyson, you're mostly in the hospital, right?
I am, yes. Work mostly in the hospital. We see patients from a wide range of diagnoses and different specialties that send us patients. Palliative care is a type of care that's been around for a very long time, 40 to 50 years now, almost 50. And we still get the question, what is palliative care? And so how do you answer that for your patients?
So on the outpatient side, for us, well, both inpatient and outpatient, palliative care is really components, and one of those components is being able to support the patient throughout whatever they're going through. So patients who receive a cancer diagnosis, nobody expects that. So being able to support them through some of the complex decisions, working with their oncologist, whether that's surgical oncology or radiation oncology, we have a whole big team. We all work together and support them through their decisions and difficult times. And the other major thing we do is help patients through their symptoms. So as we're going through any kind of illness, we typically end up with unexpected symptoms. Sometimes that's things like nausea or vomiting or pain or emotional distress. And a lot of times it's more than the patient, it's just the whole family. So our goal is to just learn your values and try to support you through that process and be your advocate. How about the inpatient? What does it look like for you on that side?
So on the inpatient, I usually will start with something like palliative care is the kind of care that pretty much all doctors in the hospital want to give. We're listening to our patients. We're wondering what their goals of care are. We're worried about the symptoms they're experiencing, and we're treating those. And that's really what palliative care does. But because there's not enough of us to see all the patients in the hospital, we want to be focused on the patients who most need us. And those are usually patients with very complex illness, a lot of symptoms, who maybe there's some struggle about what are we actually trying to accomplish, what are the goals of care in that particular patient situation, and we help the patients and their families deal with that.
What does that look like? How do you do that?
So ideally we get involved very early, usually right as soon as someone's coming into the hospital. It helps us to get to know the patient, the family, to understand what's important to them, to really evaluate what they're hoping for from their care, and do our best to make sure that care that they're receiving matches what they're hoping for when it's possible. It's not always possible.
That's pretty similar on the outpatient side. You know, the American Cancer Society always recommends that from the time of diagnosis, palliative care is offered for patients. So being a part of that from the beginning and being able to look at the person as a whole, they're much more than just their cancer. So seeing what's going on with them in their heart, in their spirit, and physically as well, and being able to support them and spending time with them to do that. We don't have unlimited time, but we do have a little bit more time, and we can kind of help facilitate relationships with their oncologists as well to make sure that they're actually receiving what they want to receive, right? Because often we kind of get put on a trajectory when we receive a diagnosis.
That's often the luxury that we have. I think every specialty would love to spend more time with their patients and connect. And it's just built a little bit so we're able to spend a little more time and understand a little bit more from the patient's perspective or the family's perspective, which is very neat. How do patients get in touch with you?
So mostly we're receiving referrals from the oncologist. So patients, whenever they receive a diagnosis or they're being treated for cancer, we really encourage everyone to just ask your providers, ask your physicians or your nurse practitioners, PAs, nurses as well. Anyone can send a referral over, especially in the Cancer Institute. We're all working closely together. What about on the inpatient side?
Same in the hospital. Ask whoever the attending physicians or providers are that you would like to see palliative care. They can place a consult and ask us to see you. If you'd like more information, you can visit our website, which we'll post as part of this link, as well as the American Cancer Society's recommendations. We also are starting a fellowship this year, which will be training future palliative care physicians here at UT Medical Center. And we'll post a link for that as well.
Sounds excellent.
Thanks so much.
Thanks.